Hello, my name is Jeff Gunther. I'm a licensed professional counselor, and today on the Mental Help Desk, we're going to be talking about what to expect out of therapy. A lot of people that are new to therapy or shopping around for therapists don't quite know what to expect. Today, this video is for you. But first, we're going to be talking about what therapy won't do for you. And the first thing that therapy won't do is that you won't feel instantly cured. Some people want to be able to come in and hope that all of their problems are going to be taken away in just a couple sessions. And that's not really realistic. Sometimes it takes 10 sessions or 6 months or a year or even over a year to start to see a change. And know that pain is not going to be taken away altogether if you go to therapy. A therapist can't take pain away. Pain is inevitable in life. We're all going to feel it. But hopefully you'll figure out how to feel it in a healthier way. You'll be able to process it. Maybe it'll be able to move through you a little bit quicker. But pain is inevitable and we're all going to feel it in life. Number 2, it won't change someone else. It's pretty common that somebody comes in and they talk about their lousy partner or their parents that they don't like, and they want to figure out a way with their therapist to change that person. That's not going to happen. It's not very realistic. We might be able to figure out if that relationship is actually serving you. If you like being with that person, we can try to figure out certain things that you can bring up or say or behave in the relationship. But there's nothing that a therapist can do to change the person that you're complaining about in therapy. Number 3, it won't be as overwhelming as you think. So some people don't go to therapy because they're a little scared of all the emotions that might come up, and they're afraid that they're going to feel flooded. They're afraid that it's going to be way too stressful for them. It's probably not as bad as you think it's going to be, and if it is bad, if it is hard and tough emotions come up, the lucky thing for you is that you're sitting in front of a mental health therapist who's trained in calming you down and centering you and making you feel a little bit more grounded or relieved. So you shouldn't be that scared if hard emotions are coming up. Number 4, you won't get advice, which is kind of a bummer because I'd like to give advice, but a therapist is trained to never give advice. So instead, we're going to look at all the options that are on the table. We're going to kind of like look at your problem or the dilemma from all different perspectives so that you can figure out what you want to do. We're going to try to figure out how you can check in with yourself to figure out what you really want to do, how you can kind of be congruent with how you want to act and behave in life. But I'm not going to tell you what to do. And you probably don't want to hear that anyways. So now on to what therapy will actually do for you. And the first thing is that it will feel really supportive. You'll be able to go in and talk to somebody that actually cares about you and is thinking about what your needs are. You'll talk to somebody who won't judge you. I'm only conceptualizing what's going on. I'm not going to shame you. I'm not going to make you feel embarrassed or feel guilty about anything. It's incredibly supportive, and I just care about your movement forward or you feeling peace and relaxation. Second, you will understand the problem better. You'll be able to look at the problem from sort of like a top-down view where you and the therapist can see everything that's going on. You'll be able to get all these different sorts of perspectives on the problem that you're facing. And if you are setting yourself up to feel that problem or to create that problem, I'll be able to call you out on that so that you can figure out if there's changes that you need to make individually so that the problem can start to relieve itself or go away. Number 3, you'll get analyzed, which is like the best part in therapy. I'm trained in understanding your psyche and how your personality developed, so I'll figure that out by asking a series of questions of family history and relationship history and different experiences that you've gone through in life. I'll be able to figure out exactly why maybe you're thinking the way that you're thinking. I'll be able to figure out if there's things that are going on that you're not actually seeing. That I might need to bring to the surface. Like Freud said, therapy is meant to make the unconscious conscious, and it's an incredibly sort of liberating and freeing experience. Number 4, you'll feel really encouraged. So you'll start to see that your things are a bit more clear in your life when you're starting to go to therapy. You'll start to feel like there's a little more direction in your life, and then I'll be able to sort of encourage you to move in that direction. The direction that you want to move in, probably. You'll be able to get a lot of tools and techniques in therapy, so lots of different ways to kind of calm down or not feel as anxious or maybe not feel as depressed. You'll feel, hopefully, a lot more renewed. And with that renewed feeling, you'll be able to move forward in sort of enthusiastic and encouraged type of way. So that's it for today's Mental Help Desk. I hope that I was able to answer some of your questions about what to expect out of therapy. If you feel like I missed something, then please leave me some feedback in the comment section. If you're a therapist watching this video and you feel like I left something out, again, leave those comments in the comment section. Thanks, and I'll see you next time.